Hi, I'm Kelsey Washer.
I'm Mark Ndike.
And I'm Dolores Bella. Thank you for joining us today as we present Enhancing Emergency Care, how AI triage systems improve outcomes in overcrowded emergency departments. Our link will be posted shortly.
First thing is our icebreaker question concerning emergency rooms. So, if you walked into an overcrowded emergency department today, what is the first leadership challenge you would notice in reference to AI triage?
Training staff with AI tools and workflows to improve efficiency.
Absolutely. Mine would be ensuring the responsible and ethical implementation of, AI technology, balancing efficiency gains with patient safety and human oversight. We would have to make sure that we are monitoring AI's performance with the data that's input.
Okay, and I think my answer would probably be communication breakdown, because sometimes in overcrowding, the best AI triage can't um, patients patients and family don't understand why AI may place another patient as priority over them. My example of that would be that I bring my child in with a broke arm and I've been sitting there for 30 minutes and another person walks in and I don't know their symptoms. They look fine to me, but AI triages them and they get to go back before me. But little do I know that they were having stroke symptoms. So, like leaders would have to coach staff how to be transparent and be empathetic to patients who don't understand why other people are being triaged before them.
Very true. Yeah.
And the lesson objectives. So by the end of this session, the learners will describe how AI triage systems function, explain workflow and accuracy impacts, identify leadership strategies for implementation, and apply learning to a case study.
So AI triage systems overview, AI algorithms. AI triage relies on machine learning algorithms that analyze vast amounts of patient data to predict the likelihood of adverse outcomes. These algorithms are trained using historical data including patient demographics, vital signs, symptoms, and medical history. Um, Also, these systems offer a transformative approach to patient management by leveraging sophisticated algorithms to prioritize patients based on the severity of their conditions. So, basically, who's sicker or who's experiencing a higher risk symptoms than maybe a broke arm, like Kelsey explained earlier. A kid with a broken arm versus a person with stroke-like symptoms. So yeah, that's how that would work.
Okay, let's jump into AI triage systems overview. So the impact on emergency care. So we do a faster assessment. So this is a study that was done by Apollo International Health Systems that showed 2 to 3 hours was saved during when they used the AI systems. Improved accuracy. So there was a study that was done in Kenya for a pilot program that improved the accuracy by 16% when they used the AI workflows. Lower documentation burden, and then there was also another study that was done at Massachusetts General Hospital, which showed 20% reduction in time spent documenting. The last one was burnout reduction. This was done by Duke Health Hospital that showed a 40% reduction when they used the AI workflows as well. And lastly, reduced overcrowding the ER. So the purpose of this training is how we can actually reduce the overcrowding. And from the study that the research that we did, we show at least 2% of patients end up leaving the emergency room without getting the treatment or care that they need. So we're trying to see how AI can manage this and resolve this issue.
When looking at AI in the emergency room, we would want to look at leadership and management strategies. Some of these strategies would be, the first one you see listed is data-driven decision-making. That would use real-time dashboards. So we would want our leaders to leverage AI triage outputs that would monitor patient acuity, wait times, and resource utilization. Also, when looking at data-driven decision-making, we would establish protocols where clinicians can override the AI recommendations based on evidence, but they would need to require documentations to feed back into the system learning. So going forward, then that would take place on its own. When you're using data-driven decision-making, you're going to use, we want it to be predictive analytics. So AI can forecast surges, like for flu season. If you're in a trauma hospital, then what kind of influx do you have? Mm-hmm. And then it will proactively adjust the staffing needs for that. Also, leaders would also need a continuous feedback loop to analyze like discrepancies between AI predictions and clinical outcomes to refine the AI. The next leadership and management strategy is empowerment through education. So this would incorporate staff training to provide ongoing education on how the AI triage system works, what the limitations may be, and how we should be interpreting the outputs. Also, patient communication. So train your staff to explain the AI triage system, how it prioritizes people, which can reduce the frustration in waiting rooms. Mm-hmm. Possibly simulation exercises, like run overcrowding drills where the staff would practice integrating AI triage into decision making. So make a workshop to where that's something that's, you know, a session where people can come together and understand it a little better. And then leadership modeling. This is big, and no matter what you're doing, leaders should always demonstrate openness to learning and showing that the AI is a tool that's a good use. It's not a threat to anyone's knowledge or any decision making. Another leadership and management strategy would be ethical AI governance. We would want to, you want to make sure that your AI system is regularly reviewed to check for disparities across like race, gender, language, or socioeconomic status, because you don't want it to get into some sort of system where there's more people are prioritized on those things versus their actual symptoms. Also, transparency standards. This kind of goes back to ensuring patients and staff know how the triage system scores are generated and used. And then leadership. Leaders should define who's responsible when AI recommendations conflict with the clinical judgment, because that can be an ethical thing as well. And then the last leadership and management strategy is the Lean Six Sigma principles. So using workflow mapping use AI triage data to identify the bottlenecks and streamline processes. Rapid cycle testing. There's a thing called Plan, Do, Study, Act. It's called PDSA, and that's a cycle to refine triage integration in real time. And then scalable solutions. So leaders would need to design improvements that can expand beyond the emergency department into urgent care or inpatient units. And then lastly, waste reduction is a big one. Eliminate redundant manual triage steps once AI proves to be reliable and will free up staff for direct patient care.
So all of this leading to our case study. So our case study is presented. A 52-year-old patient presents with chest discomfort, mild shortness of breath, and nausea. Vitals are stable but borderline abnormal. The ED is overcrowded with several high acuity patients expected to arrive by ambulance. And the AI triage system flags the patient as high risk for potential cardiac complications despite relatively mild symptoms.
So here, the discussion questions for small groups. How should the triage nurse respond to the AI high-risk alert? Second question, how should leadership support the team during overcrowding? For example, resource allocation, communication, ethical considerations. And number three, how would the team balance clinical judgment with AI recommendations?
Okay, and at this point, we would ask that you break into groups of 4 or 5 members, each taking on a role as a facilitator, a note taker, reporter, whatever. So you may define yourself and then discuss the questions in the case study for up to 20 minutes. And then we will reconvene and each group share at least 2 recommendations based on those questions and case study that we have presented.
If you have any questions, please email us. Our emails are presented at the end of this presentation.
And we do have additional resources for you. We do have internal resources and external resources, as well as infographic that will be provided to take away as a handout.
And lastly, we welcome any feedback on this presentation, and we would ask that you fill out the attached post-session evaluation form. And thank you all for joining us today.
Thank you, everyone.
Thank you.